Welcome to Our Kids Today. My name is Becky Bennett. I'm the Director of Development with Pasco Kids First. And today I'm joined by Kelly Plouffe, who's the Clinical Director of the Trauma Treatment Team at Pasco Kids First. Welcome, Kelly.
Thanks, Becky.
Last year, the Trauma Treatment Team at Pasco Kids First provided 3,000 hours of therapy to 336 children and families in Pasco and Hernando County. Kelly, tell us a little bit about what the Trauma Treatment Team does.
Well, the Trauma Treatment Team is, we began in 2007, so it's our 10th year of service with Pasco Kids First. We began as just a couple of therapists doing trauma therapy for children, but then in 2007, the Department of Health designated us as one of the only sexual abuse treatment programs for Pasco and Hernando counties.
Wow. And the Trauma Treatment Team has trauma-informed care and trauma treatment. What is the difference between those two?
It's a great question because people often get confused about that. Trauma-informed care is really the approach from which you look at a person, and it impacts all of service delivery. So for example, all of our programs at Pasco Kids First, Healthy Families, Child Protection Team, and the Trauma Treatment Program, we're all trauma-informed, meaning that the lens that we look at is we acknowledge that people have had trauma histories, and we want to really take that into account in determining what's best for them and how to engage with them. Trauma treatment, on the other hand, is the actual service delivery, the actual resolution of the trauma. And my team, we have 7 licensed clinicians. We are all designated as experts in child abuse, in child sexual abuse, physical abuse, witness to types of violence. All of them, not only are they highly trained and licensed, but we use only the modalities that are determined to be the most effective for children. Might be EMDR, might be cognitive behavioral therapy that has a trauma focus, might be parent-child interaction therapy.
EMDR that's a fascinating, when I heard about that. Can you tell us what that is?
Well, it's a modality, and it's actually a unique modality that nobody knows exactly how it works, but it works upon the eye movement. So we have the 2 hemispheres of our brain. We have the emotional side and the logical side. And what the EMDR does is allows a person to be able to process things much like when we sleep. When we sleep, it's when our brain processes all the events that have happened to us, and it gets both sides of the brain to talk to each other at the same time.
Right, so I understand if there's like a natural disaster or something, you could be the first responders, your team that has been trained in
Absolutely,
EMDR.
we can be, absolutely.
That's great. What other services does Pasco Kids First Trauma Treatment Team provide?
Our team provides individual services to children, so individual trauma therapy, and again, for those specific areas such as sexual abuse, physical abuse, witness to domestic violence, and natural disasters. We also offer group therapy, we offer family therapy. One of the most unique things that our team does that other counties don't necessarily do is we work with the parent, so the non-offending parent, the one not responsible for the abuse. We kind of help them see where they might have missed some signs and symptoms, how to help them be a better parent, and then, of course, how to parent a child that's been traumatized.
And how do people find out about you? Where does your referrals come from?
Well, numerous places. We really receive a lot of our referrals from the Sheriff's Department, from the Department of Children and Families. But because we are a community provider and a nonprofit, we receive referrals just from people off the street. Parents can call our offices and receive services. And our services are of no cost to the family because we receive funding from the Victims of Crime Act through the Florida Attorney General's office, through the Florida Network of Children's Advocacy Centers, so that there's never a burden of cost to the family.
So helping these children who have been abused, neglected, or witnessed some type of traumatic event is obviously very important. Tell us a little bit about why this is necessary.
Well, you know, the numbers are staggering. There's lots and lots of surveys now and recent research that says that at least half of our nation's children has experienced at least one or more traumatic events. And then even more recently and even more concerning is a more recent study that said 12 to 17-year-olds that there's at least a third of them that have experienced 2 or more traumatic events. And so that can impact a child's learning, their socialization, and really impact their future functioning.
Well, thank you. Is there anything else you'd like to add about the trauma treatment team or your team? I know that you're statewide recognized, recently received that recognition.
Absolutely. I'm really proud of the work that my folks do. They take pride in what they do. And I think that the only thing that I would add is, there's lots of providers for mental health services and therapy services for children. But to pay attention to what the child's needs really are, in that we are the experts in child trauma. And so it's kind of like, I would say this, would you go to a gynecologist if you had a heart problem? Probably not, right? But they're both medically trained doctors, but a cardiologist, has the expertise in the heart. So we just want to encourage people that when you are seeking services for children, to really pay attention to who it is that's treating your children and what their needs are. We know that, or at least in my experience, I've been doing this for 26 years, that many children who have diagnoses such as ADHD, attention deficit, or oppositional defiant, there's often unresolved trauma there. And so, we've had children maybe unnecessarily on medication when we could just resolve the trauma.
Well, thank you so much. We appreciate all that you do, your team does for the children in Pasco and Hernando counties, and at our Children's Advocacy Center, where our mission is to keep kids safe and strengthen families. To learn more about Pasco Kids First and the trauma treatment team, visit our website at pascokidsfirst.org.